Good evening, everyone. Welcome to another one of our arthritis webinars. My name is Ben, and I'm here on behalf of the Hospital Research Foundation Group Arthritis, previously known as Arthritis South Australia. Now, tonight's a really interesting webinar for us. It's about complementary therapies and arthritis, and we're very lucky to have two presenters from the SA Pharmacy Medicines Information Service with us here tonight. First and foremost, I'd like to do an acknowledgement of country. I'd like to acknowledge that myself and the two other presenters all present from Ghana land tonight, and we pay our respects to elders past, present and future. This webinar has been made possible through funding from the Country South Australian Primary Health Network. And I just want to make everyone aware that our question and answer is actually open for the entire presentation. So first and foremost, Corey Borg and Elise Polisena are from the South Australian Medicines Information Service. So just a quick introduction to them. The Medicine Information Services receives at least 10,000 inquiries each year. And really what they're there to do is to provide information and advice to anyone about their medicines and their safety. So even though they do spend a lot of time with people like yourselves, they actually do a lot of time educating other health professionals as well. So a quick introduction to our two speakers today. Corey is the acting lead pharmacist for the SA Medicines Information Service. He's currently completing a Masters of Clinical Science with Adelaide University and has previously served on both the Society of Hospital Pharmacists Australian Education Committee and the SA Pharmacy Residency Committee. Corey regularly provides teaching education to members of the public in South Australia and has educated other healthcare professionals at UniSA for the pharmacy degree as well. Elise Polisena is a senior pharmacist working as both a clinical pharmacy educator and in the SA Pharmacy Medicines Information Service. Elise is currently serving a position on the statewide SA Pharmacy Medication Profiler Committee, as well as the SA Pharmacy Educator Group. Elise is really passionate about sharing her knowledge and educating people about how they can get the best out of their medicines and the most safety. So I'll hand over to them now.
Cool. Thank you, Ben. And thank you everyone for taking the time out of your night to listen to us speak. So as Ben mentioned, my name's Corey.
And my name's Elise.
And we are medicines information pharmacists working with SA Pharmacy at the Women's and Children's Hospital here in South Australia. And again, thank you for Arthritis SA for inviting us to speak with you today. So tonight we're going to talk to you about complementary medicines for arthritis. And we understand there's a lot of information out there about complementary medicines, and it can be really difficult to know what's true and what's not. And to be honest, even healthcare professionals struggle with this. So tonight we're going to discuss their use, the evidence, and where you can go to get the right information you need to make the right decisions about your health. So before we begin, we would also just like to start by acknowledging the traditional custodians of country through Australia and their connections to land, sea, waters, and community. We recognise the history of Aboriginal and Torres Strait Islander peoples, vast knowledge in native plants and their uses, and that culture and country provide medicines and healing. They were our first pharmacists. We pay our respects to their elders, past, present, and emerging, and extend that respect to all Aboriginal people today. So who are we at Medicines Information? And Ben's actually given a really nice summary. We are pharmacists, and our main role is to provide patient-focused advice about medicines. Ben mentioned as well, we do respond to over 10,000 inquiries each year, and our questions come from healthcare professionals such as pharmacists, doctors, nurses, as well as members of the public like yourself. We also provide education, training, and research. The Medicines Information Service is located at the Women's and Children's Hospital, and we operate 9 a.m. to 5 p.m. Monday to Friday. And the service is available to all South Australians. So that includes healthcare professionals and patients and members of the public. So tonight we'll discuss complementary medicines, so what they are. We'll then go on to talk about what is evidence. We hear this word thrown around a lot. And what do we mean when we talk about the word evidence and why it's important to us as healthcare professionals when we help make decisions about medicines? Next, we'll move on to discussing the most common complementary medicines used in arthritis and have a bit of a chat about the evidence around them, if there's any safety concerns, and the recommendations on their use. We'll also try and help assist with where to look for reputable information or who you can go to ask. And finally, we'll just end with some key take-home messages. At the end of the session, we will have some time for questions if you have any. So complementary medicines are medicines that are not part of standard medical care, but they are used in addition or to complement standard medical treatment. They can come in many, many different forms, including tablets, capsules, liquids, oils, drops, teas, powders, etc. And complementary medicines are different from prescription or over-the-counter medicines. They can be self-selected by the consumer, and they can be purchased from local pharmacies, health food stores, herbalists, naturopaths, supermarkets, or even over the internet. And often we find it can be quite easy to forget to tell our health providers that we are using complementary medicines, because sometimes we don't think of it as a medicine, but it is really important to let them know about every medicine we use, including these herbal products. We do consider complementary medicines as a medicine, and like all of them, they can have some benefits and they can have some risks, including side effects, allergic reactions, or even interactions with other medicines and health conditions as well. So we thought we'd just touch on how medicines are approved in Australia. So there's an organisation called the Therapeutic Goods Administration, which is also known as the TGA. And this is our Australian government organisation who's responsible for regulating therapeutic goods or medicines and medical devices, all the way up from prescription to complementary medicines as well. Once medicines are approved by the TGA, they are then included on the Australian Register of Therapeutic Goods, also known as the ARTG, and many of these complementary medicines are included on this register. So when a medicine is registered by the TGA, it'll be given a number, and it's often either an OST-L or a listed number, or an OST-R, which is a registered number. If a medicine has been listed, so OST-L, it has been assessed by the TGA and approved for safety and quality, but not necessarily efficacy. So the TGA have not assessed the scientific evidence for the medicine's claims before it enters the market to be sold. And as a result, the products can only make very low health risk claims. For example, you might see things written like, this product may help with arthritis. So using the word may is a very common term they use, as opposed to saying this product will treat arthritis. And many complementary medicines will be listed medicines. If a medicine has been assigned an OST-R number, so a registered number, the TGA has assessed the medicine and it has been approved for not only safety and quality, but also for efficacy. The assessment and regulation of registered products by the TGA is quite rigorous and detailed, registered, but not all registered medicines are prescription. So for example, our commonly over-the-counter medicines like paracetamol or Panadol, or ibuprofen, which is Nurofen, these are registered products, but obviously they're not necessarily required to have a prescription to obtain. Okay.
So we've used the term evidence a few times so far, and now we're going to discuss what we mean by the term evidence and what is evidence-based medicine. Evidence refers to all the available facts or information indicating whether something is true or valid. When we talk about evidence-based medicine, we mean using the best and most up-to-date information or evidence to make decisions about using medicines and to guide our practice as healthcare professionals. With so many different medicines available on the market, it can be hard to know which one is the best to treat a health condition. Doctors need to make sure that the decisions that they make about the medicines they prescribe is supported by the best and most up-to-date information available, so that the treatment that they will provide will not only work, but it will work better than any other treatment that they could provide, and that it is safe. Healthcare professionals consider a few points to help make an informed decision about the quality of evidence and whether the information that they are reading can be trusted or not. Some of these points include, what kind of study was conducted? Not all studies can be trusted to be truly unbiased. The triangle on this slide shows a hierarchy of the different types of research or studies that can be performed and the strength of evidence that it provides. Systematic reviews are regarded as the pinnacle of evidence, as the gold standard, because they bring together many different studies and assess the quality of those studies in the same systematic way. Whereas low quality evidence is like test tube based research or animal research. Additionally, how many participants are included in the study? Was it a large study involving lots of participants, or was it a small study which only had very limited number of participants, which then can make it hard to generalize the findings of that small study to the whole population? Has the study been peer reviewed? The peer review process involves the research being read by many other unbiased experts in that particular field before it is then published. This is important as these experts can assess whether the research has been performed to a high standard or not. So to give you an example of why you sometimes may hear health professionals say there is limited evidence available or this complementary medicine has not been well studied, at the top we have a review article of topical anti-inflammatory creams in adults, which you can see included over 10,000 participants. Compare that to the bottom article, which is a review article of curcumin, and there are just over 1,000 participants. That's basically a 10-fold difference in the size of the study. So the curcumin study is 10 times smaller than that of the topical anti-inflammatory one. And commonly, research involving complementary medicines are much smaller, which can make it hard for us to then apply the findings of the study to the whole population. So we've spoken about what is evidence. Now, what is not evidence? Commonly, we will hear statements such as, "This worked really well for my auntie who also has arthritis," or "This was used for joint pain in ancient times." Now, this is anecdotal evidence-based, and it's based on one or a few individuals' experience, and it's not considered to be evidence-based medicine. Health conditions can be so variable between individuals. Just because something was said to work for someone else, it does not mean that it's going to work for you or me. You may also hear the term doing it the natural way is always better. A statement like this is opinion-based and it's not backed up by any evidence. Googling, reading blogs, Facebook posts, or reading magazine articles is not always presenting the most up-to-date and reliable information. So now we're going to get onto the actual medicines, and we're going to talk to you about some common complementary medicines that people living with arthritis may use, including omega-3 fish oils, glucosamine, chondroitin, turmeric or curcumin, homeopathic medicines, and medicinal cannabis.
Thanks. So fish oil is a type of dietary supplement that's rich in omega-3 fatty acids, which are essential nutrients for maintaining good health. Certain types of omega-3 fats can reduce inflammation from arthritis, and this may help to relieve joint pain and stiffness in a similar way to your anti-inflammatory medicines like Nurofen or Voltaren. So fish oils contain the omega-3 long-chain polyunsaturated fatty acids. So there's two main ones called eicosapentaenoic acid, bit of a mouthful. So EPA is a little bit easier to say, and docosahexaenoic acid as well, also known as DHA, which have anti-inflammatory properties. They're generally available as capsules or liquids and are widely available over the counter. So omega-3 or fish oils have not been studied in all forms of arthritis, but current research suggests that omega-3 fats may be helpful for people with inflammatory arthritis, such as rheumatoid arthritis, ankylosing spondylitis, or psoriatic arthritis. There's also some evidence that fish oil may help to control the symptoms of osteoarthritis. In terms of doses, an intake of 2.7 grams per day of fish oil containing EPA and DHA is required to achieve some anti-inflammatory effects for rheumatoid arthritis. To put that into context, if you had a standard strength capsule, this would mean you'd need 9 to 14 capsules per day, or 5 to 7 capsules of the concentrated form. Or if you're looking at the liquid, it would be 15 mils of the standard concentration or 5 to 7 mils of the concentrated liquid. So these are decent amounts of liquid or capsules that you need to swallow. For osteoarthritis, fish oil supplements of a lower dose, so it's been suggested of about 0.45 grams, may be useful, but again, there's still not a lot of information. The other thing with fish oil supplements is it may take 3 months for you to feel the full benefits of its effect. So often if people are going to try this, it may be necessary to prescribe fish oil alongside your other normal treatment as well, so like your anti-inflammatories. In terms of safety, fish oil is generally well tolerated when taken in the recommended amounts. However, I'm sure many of you have heard of the commonly reported fishy aftertaste, people report and don't find too pleasant. There are some strategies to help with that. So some people suggest taking the capsules with food or keeping them in the freezer to help reduce this aftertaste, or even having a shot of orange juice after the liquid just to help mask that taste. Some other common side effects include nausea, rash, heartburn or indigestion, and diarrhea. Some caution should be taken with fish liver oils, such as cod liver oil, as they can contain a high level of vitamin A, and we know high intake of vitamin A in the diet can actually be toxic. So taking care there. And also high doses of fish oils may increase the chance of bleeding, particularly if you're already taking blood thinning medicines that already make you more likely to bleed as well. So in summary, omega-3 fatty acids found in fish oil may help to reduce inflammation in the joints and improve the symptoms of rheumatoid arthritis for some people. Having these less severe symptoms may allow you to reduce the doses of other medicines you take for rheumatoid arthritis, but we did see that it can take up to 3 months before you really notice the full benefits of these medicines. So you may need to still continue your other pain relief medicines in the meantime. And these are typically your anti-inflammatories, or even sometimes people need short courses of steroid medicines like prednisolone. However, you'll see a common theme with this. It's always important that you don't stop taking your medicines or reducing your doses without speaking to your doctor first. Cool.
Thanks, Corey. So next we'll talk about glucosamine. So glucosamine is a sugar that is naturally produced in the body, and it is one of the building blocks of our cartilage. It's involved in cartilage formation and repair. Glucosamine supplements come in two forms, glucosamine sulfate and glucosamine hydrochloride. And it has been suggested that the glucosamine sulfate form might be slightly more effective than the hydrochloride form. Most glucosamine formulations are prepared from shellfish, including crab, lobster, or shrimp, but they can also be made from plant sources or in the laboratory. In terms of the evidence for glucosamine, studied in many different ways with different methods and small numbers of participants. Some results from older studies showed that glucosamine was effective and some results didn't. But the information that these studies gave us was of poor quality and biased, so some of them were funded by the drug companies. Overall, these studies were seen as unreliable to be able to make any clear recommendations on the benefit of using glucosamine in arthritis. When we looked at the bigger, more recent reliable studies that were performed, which we know is giving us that better quality of information, it showed that actually glucosamine supplements may provide some symptomatic benefit, but it's no better than that of taking a placebo pill, which is like a sugar pill or a fake pill. Now we'll move on to chondroitin. So it is naturally produced in the body and it is a component of joint cartilage. It helps to keep our cartilage nice and spongy and healthy. It's usually made from cow or shark cartilage, and typically it's found in combination with glucosamine in supplements. Again, the evidence is mixed for the same reasons as I just mentioned with glucosamine. There were many different study methods used and the number of participants were small. There is limited evidence to say that it may have a small to moderate effect over placebo, but those more recent and bigger studies have shown that it actually has a very strong placebo effect. Overall, chondroitin has not been found to be shown helpful for arthritis pain, but I will note that there is evidence from a single trial that suggests benefit in hand osteoarthritis. So I've grouped glucosamine and chondroitin together for the next couple of slides. As I said before, they're usually found in combination with each other in supplements. Having a look at the safety, these supplements are generally well tolerated, but again, there is caution with those with people that are allergic to seafood or shellfish. They should avoid these supplements as they are commonly made from seafood and shellfish. Glucosamine and chondroitin may interact with drugs or health conditions. So we caution its use with the drug warfarin. There have been reports of increasing or decreasing the effect of warfarin, which means that you may be at increased risk of bleeding, or your blood may be more likely to clot. We also recommend caution if you have diabetes and you want to use these medicines. Glucosamine is a type of sugar which could increase your blood sugar level. So if you are wanting to start these supplements, just let your doctor know that you're wanting to start these medicines so we can monitor you a bit closely and monitor your blood sugar levels. So in summary, the evidence of glucosamine and chondroitin for a disease-modifying effect or a symptom control effect in osteoarthritis is lacking, and many osteoarthritis guidelines do not recommend the use of glucosamine and chondroitin, including the Royal Australian College of General Practitioners and the American College of Rheumatology. I will mention, though, that the Australian therapeutic guidelines do suggest, however, if you are wanting to try these medicines, an appropriate duration of trial is about 3 to 6 months. If no benefit is seen after that, then it's recommended that to stop. Next, we will move on to turmeric or curcumin. Turmeric is a plant of the ginger family. You may recognise its use, its wide use as a spice for cooking, but it's also used as a medicinal supplement. Curcumin is the active component of turmeric that is thought to have anti-inflammatory properties and is used for symptom relief in arthritis. The evidence shows that there is uncertain benefit of curcumin in arthritis. There have not been many studies performed, but there is some evidence to show that it is beneficial. All these studies, though, showing that evidence were relatively small and did have some inconsistency in their results. Some studies also researched curcumin in combination with other products such as anti-inflammatories or glucosamine and chondroitin, which makes it really hard for us to be able to draw any conclusions to know which is truly effective out of those products. There is concern about variation in the concentration and the bioavailability of curcumin in a range of products on the market for arthritis. Curcumin is not well absorbed from our gut, and only small amounts will actually get into our bloodstream and travel around the body to the site of where it's needed to work. So as a result, it becomes really difficult for us to be able to actually recommend the best dose of curcumin for you. Looking at the safety of curcumin, it appears to be well tolerated. But again, we do caution its use with other conventional drugs, including blood thinners. It could increase the risk of bleeding, and anti-diabetic medicines. When we use your anti-diabetes medicines and curcumin together, it could increase the risk of having low blood sugar levels. It also has various other drug interactions with many other medicines, and it can change the way that those medicines are processed in our body, which can lead to these drugs not working as well, or can lead to increased risk of experiencing side effects from those drugs. So in summary, based on the very limited information available, we are unable to make any strong recommendations for or against the use of curcumin. We need a larger, good quality studies to determine if curcumin is truly effective. So next, I will talk about homeopathic medicines. So homeopathy is based on the theory of treating like with like. It is believed that a disease can be cured by using a substance that produces similar symptoms to the disease in healthy people. Homeopathic remedies are produced by repeatedly diluting or watering down an active substance and shaking. But many products then become so dilute that no molecules of the actual active substance actually remain in the product. It is believed that the final product retains the qualities of the original substance and renders it capable of stimulating the body's natural healing forces. There are very limited good quality studies performed with homeopathic products in arthritis. In 2015, the Australian National Health and Medical Research Council performed its own review of all the available clinical evidence and concluded there is no reliable evidence that homeopathy is effective for any health condition. Additionally, the Cochrane reviews, which examined the most rigorously conducted research, concluded that there is no evidence for benefit from homeopathy beyond the placebo effect. Homeopathic products are not registered with the TGA. So unlike what we discussed at the beginning of our presentation, they will not contain an OST-L number. And while most products are highly diluted, some homeopathic labelled products are not and do contain substantial amounts of active ingredients. Liquid homeopathic products can also contain high amounts of alcohol. However, if a product is truly homeopathic, it is unlikely to be harmful given the highly dilute nature of the medicine. Aspects such as drug interactions haven't actually been well studied with homeopathic medicines, but again, if they're truly homeopathic and very diluted, they are unlikely to be of any concern. While homeopathic medicines are not considered to be harmful themselves in general, homeopathy can be considered dangerous if a person relies on it as a medical treatment and uses homeopathic medicines as a replacement for conventional medical treatment when dealing with serious diseases or infections. So in summary, there is no evidence that homeopathic medicines are beneficial in arthritis, and many clinician organisations have actually formally recommended against the use of homeopathic medicines for any health condition, including the Royal Australian College of General Practitioners and the Pharmaceutical Society of Australia.
So what about medicinal cannabis? And this is a really common question that we get asked here in Medicines Information as well. So cannabis has been used for humans by multiple purposes over thousands of years. And there is a lot of interest in the use of cannabis as a medicine, as I'm sure many of you are aware of. In Australia, medicinal cannabis is different to recreational cannabis, which is also known as marijuana. And so I guess this differs from how the United States deals with it. And these products are mostly made from extracts of the cannabis plant, which we call cannabinoids. So the main cannabinoids that are studied and currently thought to be the most important for medical use are delta-9 tetrahydrocannabidiol, which is also known as THC. Now, THC is the component which is known to cause the high effect or to cause a high. And the other component is cannabidiol, also known as CBD, which does not cause this high. There are many, many other cannabinoids out there, and they do exist, and a number of them are being researched for possible medical use. However, we are still waiting for that information. Pharmaceutical preparations of cannabis contain specific active components in a known amount and in mixtures, which optimize the therapeutic benefit and minimize these side effects. The dose and strength of the preparation can be controlled and standardized, making it safer for patient use. And I guess this is different from in the US where it's legalized. We have no control over the dose people receive, the strength, etc. So it is quite a controlled fashion in Australia here. There is some evidence to support the use of medicinal cannabis in conditions such as multiple sclerosis, epilepsy in children and young adults, chronic non-cancer pain, nausea and vomiting due to chemotherapy, and palliative care as well. There is only one medicinal product approved in Australia, which is licensed for severe muscle spasms in people with multiple sclerosis, and also for severe epilepsy in really young infants. The other conditions it's unapproved for in Australia. Research so far shows that only a small number of people treated with these cannabinoids or medicinal cannabis for painful conditions notice a small improvement in pain and sleep, and there is little or no improvement in their ability to participate in daily activities. Also, research shows that many people can experience unpleasant side effects. Some of them are mild, so such as nausea, dizziness, or difficulty thinking clearly. But there may be other important side effects in the long term that we just don't know about yet. Again, these side effects will be quite different from recreational marijuana, which can depend on how you're actually using it. So for example, if people were smoking marijuana, you are more likely to have things like chronic bronchitis, because obviously you're inhaling it into your lungs. Many cannabis products may also prevent people from driving and operating machinery, which I think is something that people don't always appreciate, which before I really appreciated as well. It wasn't something I considered. For example, it is a criminal offence if you're found to have THC in your bloodstream while driving, and you will lose your license. So it's just something to bear in mind if this is a path you want to explore. Medicinal cannabis can potentially interfere with many prescription medicines, such as blood thinners, medicines for epilepsy, opioid pain relievers, just to name a few. There are many, many more as well. And I guess overall at this stage, the Australian Rheumatology Association does not recommend medicinal cannabis for arthritis or any other related conditions as well. The other thing to bear in mind is medicinal cannabis can be quite costly. We've been told figures range from about $200 a month. I've certainly heard of over $1,000 a month, depending on the type of product you get as well. So it is another thing just to keep in the back of your mind. To confuse you even more, as you can see, there are many, many other possible complementary medicines and therapies that have been suggested to be used for arthritis. And really, we've only just touched the surface in today's presentation. There are many more being studied. There are many others that have been studied for arthritis as well. And I guess it's just something that will continue to evolve with time. Now, I guess overall, we're not here, and our intention is not here to tell you what you can or cannot use, but really, it's something you want to start looking into. So if you want to start using a complementary medicine for your arthritis, or any health condition for that matter, there are some things that we want you to consider before you start taking them, and just some take-home messages to leave with today. I guess we want you to have a think about what are the benefits and what is the scientific evidence to support its use. As we've discovered today, complementary medicines may not be well studied compared to some of your traditional prescription medicines, and there's often limited available information about their safety and effectiveness. We've briefly touched on the affordability of some of these medicines. Some of them can be quite costly, which is just another factor to consider with the rising cost of living at the moment as well. Is where I want to buy the medicine from a reputable source. So many community pharmacies sell these types of medicines, but you may be able to buy products over the internet, for example, which have not been evaluated by the TGA for any safety standards. And it's not uncommon to find that some medicines that are purchased online, their label will specify what ingredients on there, but they may actually contain different ingredients, or they may contain much, much more ingredients than what's actually listed on the label as well. It is a common thing that we do talk to people about, just to be mindful of. Are there any other health conditions that you do have? Just like any other medicine, complementary medicines can interfere with particular health conditions. And Elise did mention earlier that glucosamine can affect your blood sugar control if you're a diabetic, for example. And what is the safety of the medicine? You know, are there any possible side effects? Are there any side effects that do concern you? Can they interfere with some medicines or treatments that you're currently on, or any of your current health conditions? And a common misconception, natural does not always mean safe. Just because it's natural, if you're expecting it to have an effect on you and a beneficial effect, there's always a chance that can have a negative effect on you as well. And really, at the end of the day, we just want you to have that open discussion with your doctor, your pharmacist, or your nurse, just to let them know that you're interested in starting to take them. I guess really at the end of the day, us as health professionals, we are here to help support you make the best decision for your own health. We will give you all that information that we can find because it is tricky to navigate. We will tell you some of the side effects. We will tell you some of this evidence, and we'll tell you, do we think it interferes with your medicines, just so you can make that best decision for you. And if it is something that you do choose to use, we can help manage those side effects or monitor things that we want you to look out for in case you do take them in combination with, you know, your other medicines or with other health conditions as well. So where can you go to get some of this information? Especially in the community, it can be really hard. And even us going on the internet, there is so much information out there. It's just really difficult to know what you can trust. And I guess really we've got a lot of trustworthy people out there or sources of information that we can go to, and we'd probably recommend going to first to help you make informed decisions about your health. Some useful places are your local pharmacy or your chemist. They're free. You don't usually need a booking to get in because obviously it's really quite hard to get in to see your local doctor sometimes. They're really sometimes a great first point of call. And sometimes they can even give you some consumer information that is often provided by the drug companies themselves. Of course, we'd always encourage you to speak with your GP or your specialist. They know your health best and they can just discuss some of your treatment options, let you know if they're wanting you to, and basically let them know if you want to start a complementary medicine so they can review its safety for you and your healthcare needs. Sometimes we do find when people are looking to start medicines, so herbal medicines, it might actually be because their condition's not being well controlled. And if their doctor's not actually well aware of that, there might be some other things that they can do to help get in control of it as well. So again, having this open discussion is really important. Obviously, Arthritis SA specifically for arthritis, again, they will really understand your condition and your treatment. And again, that would be a great source to discuss with when you have your appointments there. And of course, we are here at the Medicines Information Service in SA. We're always happy to give you a second opinion, or if you've just got some general questions that you'd like to just pick up on the phone, we're always more than happy to help. And I guess if you have a question or want a second opinion, please feel free to contact us here at Medicines Information. We are open 9 AM to 5 PM weekdays, and our telephone number is on the screen. Cool. Any questions?
Cheers, Corey and Elise. That was fantastic, and it really went over a lot of the things that we're asked pretty regularly, and is one of the people who's lucky enough to go out and do a lot of community talks and community education and has spent a bit of time on our info line. They're really the big ones that we do get asked for. The questions and answers are open if anyone does have any questions. The first one that I've got, and it's one that we get pretty regularly, can either of you explain the difference between, I guess, slow release paracetamol and then kind of the normal release paracetamol? And then why is the kind of Panadol Osteo behind the counter compared to the normal one just out on the shelves?
Elise, you want to take that one?
Yeah, so when we're looking at normal release paracetamol or normal Panadol, which is one of the most common brands, that is what we call an immediate release tablet. So basically we take the tablet, it goes into our gut, it gets dissolved and it gets absorbed through to our body, and that happens pretty much straight away from when we take that tablet. And because that is happening and it's being released into our body immediately, we do use it for more of your more acute pain. So for example, if I happen to have a headache that comes on straight away, I'll go to my normal Panadol tablets, I'll take the tablet and it will start to work straight away. If we compare that to the Panadol osteo tablets, they work in what we call they work like a controlled release tablet. So basically we take the tablets and the amount of time that it takes to get absorbed into our body is much more in a controlled manner, so over a longer period of time. Now, because they work that way, we would prefer to use them more for persistent pain or chronic pain, which is what we might experience in something like osteoarthritis, for example, where we're feeling that pain pretty much all the time. Because with the osteoarthritis tablets, you're getting that sort of constant level of drug coming into your body instead of a big peak like what we would get with the normal immediate release paracetamol tablets. We do use them to help try and prevent that pain or manage that persistent pain throughout the day. In terms of taking these medicines, the normal immediate release Panadol or the normal paracetamol tablets, you take up to 4 times a day. They'll give you that big peak in the amount of drug that's in the body. And they'll work pretty well straight away for that acute pain. When we're looking at Panadol osteo tablets, they work in a bit more of a consistent manner, and we take them a maximum of 3 times a day throughout the day. So the Panadol osteo tablets contain a slightly higher amount of the active ingredient, and we take them 3 times a day, whereas the immediate release Panadol tablets contain a bit more of a lower amount, but we take them more frequently throughout the day. Do you have anything else to add? No.
That's a really good way of explaining it. So there's no difference in kind of what's actually inside the tablet, and it's just mainly actually how they're released overall.
Yeah.
Yeah, perfect.
Perfect. So we've got a question here about naturopath supplements. Would you consider naturopath supplements to be on par with homeopathic supplements, or is there a bit of a difference with those?
Yeah, I guess they are different. As Elise really nicely explained before, I guess your homeopathic supplements are sort of this dilute nature. There is a theory behind how they work, and they basically get diluted. You take a drop out of that, you dilute it again, you take a drop out, and you keep doing this, and it's shaken in a special way to help treat a condition. With naturopaths' medicines, they will use medicines or complementary medicines that are not diluted, so they are full strength, if you will. Again, I guess there are some similarities. However, they're not always registered. Well, they're often not registered on the TGA, so they're not always controlled in terms of efficacy and safety and assessed for that. And I guess as well, there's not always a lot of information about their use as well. So again, we get asked quite a lot about some medicines that naturopaths might have recommended for, just in terms of the safety with their other medicines. And again, we still will treat them like a normal medicine and acknowledge that there not always is a lot of information about them, which can sometimes just make it really difficult for us to give you good advice about it. If there is no information about it, there's not much more we can say apart from, have a discussion with your doctor or your nurse or your pharmacist about if this is best for you.
That's kind of the important thing with, I guess, some of like naturopaths and those other kind of people promoting more maybe the more natural ways. It's just to chat to your GP first, or your specialist, your rheumatologist, to make sure it's going to be safe first.
Yeah, exactly.
Perfect. Back to that first kind of point that you touched on with that Ostel and Ostar numbers. Is there any kind of information out there with the difference of a cost between those two? Like, how much does it cost for one of those drug companies to actually have it, that it's actually listed, compared to just that safety data? Do you have any information on that, or is this person kind of putting you on the spot with it?
Interesting question.
So to be able to get a medicine registered by the TGA, they do, the drug company does need to provide lots and lots of information about its safety, its efficacy, and what's actually inside of the medicine. Now, to gather all of this information in general, it takes lots of research, which does cost quite a lot of money. In terms of the specifics about how much it might cost, I'm not exactly too sure, but considering that for a medicine to be listed as an OST-R, we're actually trying to prove that this medicine definitely works, and the claims that it's making are exactly what it is intending to do. To be able to make those claims and get it registered as OST-R, you need much more rigorous research, much more detailed and thorough clinical research. So that does cost a lot more money to be able to carry out those clinical trials and gain that information to then bring to the TGA and show them that these are the results, and that this medicine, I'm telling you that this medicine does this job, and this medicine has shown to do this job. So OST-R medicines would cost in general more than what it would cost for a medicine to get listed as an OST-L. In terms of the exact amounts, I don't actually have a number, but yeah, that's the sort of difference between the two.
That's a really good answer. I will say, because that one came through earlier during the presentation, I had a little look. And most of the studies just talk about America, but the estimates are really, it's between $314 million to $2.8 billion to actually get a drug from the start of market to the actual end. So it's very, very expensive. And I think a lot of people don't understand how long it actually takes as well. Is that for a drug to actually get onto the market, it's a massive amount of time and a massive amount of research compared to a lot of the supplements and things like that.
For sure.
We've got another one. It's asking about evidence for magnesium tablets and if they're good for muscle health.
Yeah, okay. We occasionally, just from a pregnancy point of view, actually, we get occasionally some questions about using magnesium for magnesium supplements for muscle cramps in pregnancy, for example. I'd have to look in terms of the more latest information. I have to double check, but I mean, in these situations, there's not a lot of information. The way we sort of put it to women is, in pregnancy, for example, is look, if you're having safe doses, it's relatively safe as well. And unfortunately, sometimes these muscle cramps in those situations are really difficult to treat. There is no magic cure for them. So if people wanted to try them, again, letting their doctors know or their specialists know that they are wanting to try it, and we can come up with a safe dose for them to use. You'd have a try for a period of time, but if it's not helping, then obviously there's no point continuing it as well. So yeah, it is the one that comes up a little bit. The flip side is when you push magnesium, if you start having really high doses, you get quite a lot of stomach upsets, and sometimes that does prevent people from having doses that they find helpful. Magnesium is sometimes found in some of your laxatives, so people that have constipation. So it's not surprising. So again, it's just trying to find out, does it help you without giving you, diarrhea where you can't get off the toilet now? It is just finding out what works best for an individual.
And so someone's followed that up quickly in the chat as well. Is that magnesium oil, and what's your opinion on oil? Is that similar, or is that a bit of a different answer with that one?
Yeah, good. Probably a little bit of a different answer. I know there's some magnesium sprays out there and things like that. There's not a lot of information to really support its use. Again, if it's something that someone wanted to try, and if someone said, yes, I find it really helpful, who am I to say that it didn't help you? But I guess to really answer your question, if someone said they've got really bad muscle pain, do I recommend a magnesium oil or spray? At this stage, it's not something I'd actively say, yes, everyone should go out and get it. But again, I guess you're sort of going to see a bit of a trend with these complementary medicines is if it's something you choose to want to try, we can sort of help guide that in terms of safely using it and seeing how it goes, in combination with your specialist or your GP.
Perfect. Good follow up with that one. So talking about specialists and GPs and things, we've had a few people asking about really prescription medications, or asking about around specific prescription medications and which ones are best with anti-inflammatories and things like that. Do you want to speak briefly on those and kind of where, as pharmacists, we kind of sit in making those decisions? Because we've got questions, for example, like what's the best anti-inflammatory for arthritis pain, or like what's your opinion on naproxen and things like that. You want to talk about that as kind of like an overall whole with those ones?
Sure.
Yeah. So I guess there are quite a few different anti-inflammatories. They all belong to the same class of medicines. They all work exactly pretty much in the same way. We would typically, there are some that you need a prescription for, so you need to go to the doctor, and the doctor needs to review you and see if it's appropriate. They will then write a prescription for you, and there are some that are just over the counter that you can have a chat with your local pharmacist about, or you can select yourself. So the ones that are over the counter generally are not as strong. So they're probably a good starting point for someone who has arthritis and is in pain. And we would always try and recommend using the minimum effective dose for you, and starting off with some of those medicines that you can buy just over the counter at your local pharmacy. They may include things like Nurofen, which is ibuprofen, Voltaren tablets, which is diclofenac, or naproxen tablets. So a little bit less potent, a little bit less strong, if you will, but they could potentially still provide the required amount of relief that you need for your arthritis. If you have then trialed those anti-inflammatory medicines and you're finding that they're not providing the relief that you need, and you're still in pain, then that would be a trigger for you to try and talk to your doctor or your specialist about, let them know what you trialed, and then potentially they will assess you and see if it is appropriate for them to then prescribe you those stronger anti-inflammatory medicines that you require a prescription for to get as prescription medicines at the local chemist. An example of that might be celecoxib, for example, but we wouldn't sort of jump to something that's a prescription medicine straight away without potentially trying those over-the-counter medicines that could still be effective for your arthritis pain.
And the other thing with some of those is some of your prescription ones actually last longer in the body. So you might Elise touched on Nurofen and Voltaren, which you need to take several times a day, which, again, if you've got those, if you just got you've been in the garden, you've been bending over and you've got a bit of a bad back with your osteoarthritis, something like Nurofen or Voltaren, if that's safe for you to use, might be a good idea, because you can just have, if you only need it for a few hours and that'll get you through, that's perfect. There are some of those prescription ones where you only need to take it once a day. But again, if you just had a small bit of pain that was only going to last an hour or two, there's no point taking a medicine that's going to last so much longer when you don't need it. So again, sometimes they will consider that when they're recommending some medicines for you as well. So it does depend on the type of pain as well that you've got.
With those anti-inflammatories as well, I kind of touched on it. Is it important to treat them what you've been talking about with the supplements as well? Should people talk to their doctors before they start taking those ones?
Yeah, definitely. Again, it's another really common question. Some people might know that anti-inflammatories, as with everything, can have some side effects. They don't always agree with people that have kidney damage or kidneys that are not working as well, and that can cause some problems there, particularly if people are using for a while. Sometimes they can cause some stomach issues. So if you've had stomach ulcers, for example, it is something we want to be cautious with. So yeah, absolutely, Ben. If people are thinking about using really any medicine or complementary medicine, again, speak to your pharmacist, speak to your doctor, because again, we just want to making sure that you guys are doing it safely, essentially.
A really, really good answer with that one. The next one I've got is about essential oils, and are they safe to use? And then, as a role, can you comment if they're effective, or is it a bit of a case-by-case basis with those?
Yeah, we don't. I guess essential oils from a pharmacy point of view, it's not something we're involved with heavily. I guess sometimes people use essential oils as part of massage, for example, and from a complementary medicine point of view, massage is another branch of that. And again, there are other people that specialize in that area which may use those types of things. Probably from a pharmacy point of view, one of the main things that I would often mention to people is they're very toxic if you take them by mouth. So some of them can be quite dangerous. Like, for example, if you've got children at home, we just want to be really careful with those types of things, as with most medicines anyway. But I guess from a pharmacy point of view, yeah, look, there is some evidence that massage can be quite helpful for some types of arthritis conditions, where they might use essential oils or aromatherapy in those kind of cases as well. Some information has been there to say that it might help some people.
And I guess just to add to that, if we're using it as aromatherapy or as massage to help with massaging, our skin is really good at trying to keep out things that we place onto our skin. So the amount that you'd actually be getting absorbed into the body from that type of massaging is quite minimal. So we probably wouldn't have too much of an issue in terms of safety with aromatherapy or using it as massage therapy. But if, like Corey suggested, we sort of wouldn't recommend it being ingested. It can be quite toxic.
So it's more so that thinking about it, it's probably the actual physical massage and things like that, rather than actually thinking about the aromatherapy and the essential oils that are in there that's probably doing the benefit.
Yes.
Good answer. The next one we've got is kind of like another oil, is someone asking about if there's any evidence behind emu oil for arthritis.
Okay. So with emu oil, there is some components of emu oil that are actually similar to some of the ingredients in fish oil, for example. So there is certainly some interest in those components, and can they have anti-inflammatory effects? My understanding is with human research, there's really not a lot of information yet. I know there is certainly some interest in that area, but particularly for arthritis, I'm not aware of any good studies yet that have even really looked into it yet. I think it's an area to keep an eye out for, as for many of these medicines that we've discussed. But again, at this stage, if people are saying I've got arthritis pain, it's not something we can actively recommend until we get some information to say whether it helps or doesn't at this stage for arthritis pains. And again, we've seen and we know there are many different types of arthritis pain, so we do need a lot of information just to see if it actually does help. But yeah, good question.
So it's one of those ones of that there's not enough actual information out there to make an educated kind of actual
Correct
decision about. So you've got to err on the side of caution. Correct.
Yeah, that's right.
Another one is a kind of classic pharmacy question. I can say that from my time in pharmacy that I used to get a lot. Can you comment on the difference between generic medicines being the same as brand name medicines?
Sure. Do you want me to? Or?
Yeah, I don't know.
All right, you go.
So when we talk about brand and generic medicines, it can actually be really quite confusing, and often a lot of people do get confused about the different words and terminology that they mean. If we think about a brand medicine, that is the medicine that the first drug company making that medicine will call, that's the brand that they assign to this medicine. It's not the actual active ingredient. So, for example, Cadbury is the brand and chocolate is the active ingredient. So that's how we sort of describe the brand. And generally, the drug company that first makes this medicine will call this medicine a brand. And then after a period of time, any other drug company can then make that same medicine. So any other drug company, for example, could then make the same chocolate. Now, the drug company does need to show that it contains exactly the same active ingredient and that it contains it in the same strength, and that it is comparable to the way our bodies will absorb that medicine and the way it works in our body. They can't call it the same brand, so they will call it by its generic name, which is the actual name of the medicine. So basically, the brand name is just the name given to the medicine. Think of it like Cadbury, and the generic name is the active ingredient. And other drug companies can make the same generic medicine. I don't know if I explained that quite so well.
That's right. I guess a good example is like Panadol and Panamax. So they're two types of brands or generics. Panamax is almost like a generic of paracetamol. It's the exact same drug, and yes, you can use one or the other. For some of your prescription medicines, your pharmacist will be there to help, because there are some guides as to most medicines so most brand medicines and their generics can be interchanged, but there are some where people might be a little bit more cautious with. So some of your immunosuppressing medicines, for example, or some of your cancer treatments. But yes, generally, I guess like Elise said, it's the active ingredient that we're really looking for, and we want to make sure that's the same.
Perfect. Really good answer by the both of you. I'll just let everyone know that we're getting to 8 o'clock, unfortunately, so time is running a bit short, and Cora and Elise are still at work, so they've spent quite a bit of time there today, so I've got to let them go at some point. I will say that I've got everyone's questions that they've asked, and then some of them I'll put to Cora and Elise, and then some of them we'll be able to answer here through Arthritis SA. I just really want to thank both of you for your time and such a fantastic presentation. It was really lovely to have both of you on and speak so confidently about a lot of questions we know that people living with any type of arthritis have. And I want to take everyone who's come along tonight for, thank you for the time, for actually coming and spending it with us. It means a lot, and hopefully you got something out of the presentation. Yeah, thank you very much, Cora and Elise, and thank you everyone for attending tonight. We'll have another webinar next month, and I hope you enjoy the rest of your night.